Community health begins with knowledge and continues with awareness. Our bodies send signals, signs, and symptoms that tell us when something isn't right. But it isn't always easy to tell what to do when something isn't normal. Should we seek help, or should we wait? In many communities, doctors and nurses may be far away if they're available at all. Families are left to wonder what to do. This video offers some advice and provides information about signs and symptoms that may help you decide. It also describes why community health workers, CHWs, are so important. They are expertly trained to recognize early signs of illness, to answer questions, and to guide families toward the right care at the right time. Illnesses often begin quietly: a small fever, a cough that lingers, a cut that doesn't heal. Most of the times, these problems improve with rest and simple care at home, but at other times, they are the first signs of something more serious. Paying attention early can prevent a small problem from becoming dangerous. Here are some of the most important symptoms to watch closely. Fever, especially if it lasts more than 2 days, is very high or is joined by chills or sweating. Cough or breathing trouble, a cough that gets worse, fast breathing, chest pain, or wheezing. Persistent tiredness or weakness, feeling too weak to play, attend school, or work. Pain that increases, pain in the stomach, head, chest, or joints that doesn't improve or keeps getting worse. Changes in behavior or confusion, a child who is unusually quiet becomes hyperactive. An adult who is usually easygoing becomes irritable. Anyone who seems disoriented and confused. Skin problems, rashes that spread, wounds that stay open, cut that have swelling. Stomach issues, vomiting or diarrhea that doesn't stop, especially if there are signs of dehydration, like dry lips, sunken eyes, or little urination. Headache and blurred vision, sudden and/or severe headache and blurred vision can flag a serious condition that might need immediate attention. These are signals that something may be wrong inside the body. Some symptoms are mild and can be cared for at home. For example, a small scrape can be cleaned and covered, or a slight cold may pass with rest, fluids, and good nutrition. But here are the warning signs that mean you should not wait. Symptoms that are persistent and last longer than usual, such as a fever for more than 2 days. Symptoms that suddenly get worse or are severe, like breathing that becomes fast or painful. Symptoms that interfere with daily life, when a student is too weak to go to school or an adult cannot work. Symptoms that cause fear or uncertainty in the family. Symptoms that do not improve with home care. When these signs appear, it's time to reach out. Delaying can allow an illness to spread or become life-threatening. Doctors, nurses, and clinics may be widely available in some places, but in many low-resource communities, CHWs are often the first and most reliable, effective sources of care. They visit homes to check on families, answer questions about symptoms, provide simple treatments, such as dressings for wounds or oral rehydration for diarrhea. And most importantly, they know when it is time to connect you to a clinic or hospital. CHWs are not doctors or nurses, but they are well trained to recognize danger signs, sometimes before families notice them, and to act quickly. Picture this. A teenager has had a fever for 4 days. His family gives him teas and hopes he will improve, but he becomes weaker and stops eating. Instead of waiting longer, the family calls their community health worker. The CHW checks his temperature and explains, "A fever lasting this long may mean malaria or another infection. We need to get him to a clinic now." The CHW arranges transport and accompanies the family. The teenager receives treatment and recovers. Because the family recognized the symptoms and reached out, his life was protected. CHWs don't respond only when people are sick. They are also teachers, showing communities how to stay healthy, how to clean water, prepare safe food, prevent mosquito bites, and care for mental health. They provide communities with critical information about infectious diseases that may be affecting the population. Here's what to remember. Pay close attention to symptoms: fever, cough, weakness, pain, confusion, rashes, and stomach problems. Care for mild problems at home, but never ignore symptoms that last, worsen, or disrupt daily life. When in doubt, reach out to your community health worker. They will listen, advise, and connect you to care if needed. Recognizing symptoms early and acting quickly can mean the difference between recovery and danger. In communities where doctors and nurses may be far away, community health workers are the bridge to health and healing. Good health begins with knowledge. It continues with awareness. It grows with action. And it is protected when families and CHWs work together. So remember, recognize, respond, reach out. Your health and your community's health depend on it.